All right, everybody, here's my presentation of my poster on type 2 diabetes. Our abstract, we'll start there. With type 2 diabetes rates rising, young people need to be able to understand if they are at risk for debilitating chronic disease. So in our study, we tried to capture the understanding of risk and where youth were getting their information concerning type 2 diabetes. We just wanted to know how much knowledge they had on it or if they were able to identify risk factors and such. The background section here just has some information about type 2 diabetes and the risks involved with that, and just kind of how important it is that these youth today, between the ages of 18 to 25, understand the risks and how to prevent type 2 diabetes. So I know it's hard to see, but the objectives there, we wanted to answer the following research questions. Where are young adults aged 18 to 25 receiving their type 2 diabetes information, and how influential is each source to their perception of the disease? To what extent can young adults aged 18 to 25 identify risk factors for type 2 diabetes? To what extent do young adults aged 18 to 25 understand the severity of type 2 diabetes? And to what extent do young adults aged 18 to 25 understand that type 2 diabetes is preventable, and are they aware of the prevention methods available? So the methods that we used to gather this data and information was a survey through Google Forms. It was about, a 10-question survey that just kind of asked respondents to identify risk factors, complications, warning signs, symptom management techniques, and prevention methods. They were also asked to mark where they received information about type 2 diabetes. We had some demographic questions, stuff like that. And after eliminating the responses outside of our target group of 18 to 25-year-olds, we completed t-tests and one-way ANOVA tests to evaluate the data on a more statistical level. So the graphs that you see here and here, this one is from one of the questions that we asked if type 2 diabetes was life-threatening. And these ones here are the results from where they received their information about type 2 diabetes. These tables here tell us which people were able to identify risk factors. This is based on education level and if there were differences between the 4 levels of education and how many risk factors they could identify. This one is similar, but just by gender. And so we wanted to see if there was a difference between males and females concerning risk factors. The only statistically significant difference we saw between any of these groups was with education level and with the sources that people received their type 2 diabetes information from. And so it was just that people with a bachelor's degree or higher had more sources available to them. All of our other results just on like how many risk factors or complications or warning signs were our respondents able to identify. So from this study, we concluded that young adults aged 18 to 25 have an understanding of the diabetes risk factors, severity, and preventability. Respondents were able to consistently identify at least 50% of the potential risk factors presented. This was true among both male and females and all education levels. Underrepresentation from ethnic minorities made statistically significant data analysis impossible for this study. More research should be conducted among young adult ethnic minorities as they are at an increased risk for type 2 diabetes. We were also unable to determine the influence of the sources that respondents selected when asked where they received information about type 2 diabetes. A more in-depth survey should be done to determine the level of impact each source has on the individual. All right, this has been Young Adults and Type 2 Diabetes, Understanding and Risk Perceptions. Thank you for watching.